Dr. Patino here at the Cosmetic Surgical Center of Rosarito. So this is micro-air power-assisted liposuction. And you're gonna be the first ones to see what comes out here. This is an electric tool, so I am not, driving that instrument back and forth with great force and great speed. I do this in a very unusual and very unique manner, I would say. Take a look at what comes out. Are you looking at that tube right there? What color is that?
Yellow fat.
Aspirated, right? Why is it yellow?
Because there's no blood.
No blood, right? Why there's no blood?
Because that's how we do things here at the
That's how we do it, huh? So it's a multiple things, right, Gabby?
Right.
The reason why there is no blood when we do these. What color is that, huh? Wow, this is incredible, right? It's a yellow gold, right? And so many reasons. I think the number one reason is how slow my movements are. That's number one, but there is a variety of reasons, and most surgeons, they just want to go very, very fast and get through the case, right? And then the aspirate is going to be red. If I were to do that also, it would be red for sure. And more risk, right? More risk of perforating something that you don't want to perforate, right? But I think it's like a bullet, you guys. Let's imagine a bullet, right? And I put a bullet in my hand and put the bullet against my other hand. What happens? Thank you. So notice my movement. So slow, right? I mean, very, very slow, very meticulous. And I know our anesthesia provider is probably worried. Brian, when are we going to be done with this case? Dr. Patino is so slow. I try to tell them I'm slow. But what it is that, we actually are going to do a very good timing because we don't have to, process that fat. We don't have to spin that fat. We've never done that. And we do that in a very controlled manner. And so whatever you see is what's going to go into her buttocks, right? Pure, beautiful yellow fat. We're going to show you. When we put the fat, it's going to be this very, very fat, this yellow very fat that we're putting in there. So obviously, that's a big problem because when you do these, and Brian was telling us that the surgeons or some of the surgeons that you work with, they don't do it. And one of the reasons he mentioned, right, Brian, is because like 2 years later or something, the butt is gone. Is that what it is? That's right. And it doesn't happen to us, and but it is true that up to 50% of this fat you can lose, right? But it all depends, right? Like different ways to make a soup, right? And so this is different ways to skin the cat, some people say. And our technique is different, our results are different, and our fat lasts a long, long time. And the reason why I believe is because what we put in there is pure fat. So obviously, if you put red, whatever goes into your buttocks, without being a doctor or a CRNA or whatever, if whatever goes into your buttocks is red, beautiful. But yeah, if I use the same bullet, right, and I put it at high speed on a pistol or a gun, it's gonna penetrate my hand, and there's gonna be a wound, and there's gonna be bleeding. But if I just press it against, without a pistol, nothing is going to happen. So it's a similar concept, right? If I go slow and gentle, nothing's going to happen. Thank you. Okay, so this is what is called the pinch test. See? So we're pinching here, you guys, and this is part of the surgery, right? So we're pinching to see, is there any excess fat, right? And we want it to be like even. See? All this is even. No, this is the waist right here. The buttocks are over here. She's on her side. But notice the complete, wherever I go, look at this. Wherever I go, there is literally, and I can lift this all the way like that. Look, see? No excess fat at all. Thank you. Okay, so this is ultrasound gluteal fat transfer. And notice the fat that's going in, you guys. This is incredible, right? Yeah. Beautiful yellow fat, right? Thank you. Wow, so this is the way to do this procedure safely, and notice what we're talking about. See, yellow, beautiful fat. Are you showing that yellow fat going in?
Yeah.
This is incredible, right? It's not red, it's yellow, and it's beautiful. And this has to do with fat graft retention, obviously, right? Thank you. Okay, so basically what we're doing is we're doing this under ultrasound guidance, right? And we're teaching doctors how to do these in several parts of the United States and the world through the World Association of Gluteal Surgeons to make sure that we do this procedure in a safe manner. Put in the fat where God wants it, right? Where God put it between the skin and the muscle. And that's what we're doing, right? And look at the quality of that fat. What color is that fat, Elena?
Yellow.
¿De qué color es la gordura de Elena?
Amarela.
Amarela. ¿Por qué es amarela, Elena?
Porque não tem sangue.
No tem sangue?
Não.
They're bald.
Okay, hey guys, so today we're doing ultrasound guided gluteal fat transfer. So doctor's instrument is right here. It's the cannula.
I'm gonna wiggle it. You see
It's
it?
wiggling it right here.
See?
And then this is the subcutaneous space, and you can see actually in her case that the striated muscle and the deep gluteal fascia is, higher up than what we may see in a lot of other patients, which means that this is the area that he wants to transfer fat, and it's really good that we're in an ultrasound because we get to see, where is doctor going to put the fat.
Let me show you the tip of that cannula, and I'm gonna withdraw it a little bit. I'm gonna withdraw it, see?
Yep,
It's
the
already
tip's right there.
and now you're gonna see, I'm gonna give it a little bolus so you can see.
So he's putting in fat into the space, and you can see the
Show the tip of the cannula right there.
It's right
there
there.
we go.
Yeah.
And I'm gonna give you a bolus right there so you can see it.
So fat's moving into this space, and you're going to see the deep gluteal fascia move.
Okay, so this is the ultrasound gluteal fat transfer, as you can tell, and we're gonna show you in a second the video over there. Okay, thank you.
All right, so like we were saying, this is her space where doctor is going to be putting in fat. That's the subcutaneous space. This right here is the deep gluteal fascia. This is the muscle where we do not want to put any fat. So this is doctor's cannula. He's going to wiggle it for you. Wiggle, wiggle. And he's going to put in fat into the space, and you're going to notice that this line moves up and this line moves down as fat goes into the space.
Okay, let's do it. Right now, you're gonna see some fat. Show him the tip of that cannula.
Right there.
You see the cloud of fat that's going in,
Which is
and how
coming
the deep gluteal fascia is moving down. You see that?
Amazing, huh?
It's incredible. That's a nice take, you guys. And we're still seeing beautiful yellow fat, right? Woohoo! Incredible. Toward the end of the procedure, almost done. Thank you.